My name is Svetlana Barstein, and my son's name is Michael, and he's now 15. We started to see Dr. Michael when he turned 12. And before that, Michael was battling with a condition called eosinophilic esophagus. This is a fairly new and unique diagnosis. This is something that causes your in your esophagus blisters to come out. Blisters so bad that when they erupt, they can cause scar tissue to develop, and a patient, if she's not treated, may end up with a plastic tube inside the esophagus to let food go in. And that tube is supposed to be changed every month or so. And that was the perspective if this condition is not treated. When Michael was diagnosed with that, it was done by a biopsy, and his numbers, the bad numbers, were quite elevated. So the normal numbers were between 0 and 20, and his numbers were 60 or 70. And regular doctors prescribed them to first do elimination diets to find out what was causing that, because 80% of the patients suffer it's a food allergies that causing that, and 20% of the patients are caused. This condition is caused by environmental problems. So we started a round of elimination diets, and we had 8 elimination diets. They each lasted for 8 weeks each, and after that there was an endoscopy done with biopsy taking and under general anesthesia. On a little boy, that was pretty harsh. And each time with each elimination diet, so we eliminated positive, possible offenders such as soy, wheat, or whatever. After each elimination diet, the condition worsened, and the numbers got worse and worse. And then doctors just gave up and said it must be environmental, and if it's environmental, we cannot eliminate that. So the only treatment is to have steroids taken. And for a 12-year-old boy, it was quite harsh. At that point, when I hit the wall, I decided to look for some other treatments. And still, my son had this very bad situation with his GI. He had bloating, gas, and constipation, diarrheas. He had heartburn and nausea, and all this set of things, was going on, and we didn't know what to do. And my personal trainer recommended me Dr. Michael as an option. She said that he had helped her with her autoimmune disease. And as a last resort, I decided, okay, I'll try it. And at that point, I was really desperate. We came to Dr. Michael, and he looked at my son. He spent first 2.5 hours working on him, diagnosing, trying to fix something. And he said that no problem. He thinks that in 45 days, my son will be treated. And I couldn't believe my ears. I thought, I asked again, are you sure that his condition will be gone? He said, yeah. Because, Dr. Michael said, we will treat the whole body, not just the symptom. Okay, I said, why don't we try? So Dr. Michael prescribed us a set of supplements and routine, there were no drugs. There was shakes and pills, herbs, and it was very complicated to follow because my son's condition was very, very bad. But especially with a boy, to have him drink shakes and all these pills in time and before and after food. So we religiously followed that because my son was very scared to have this tube. In his throat. And in about 30 days, another endoscopy was due. And the doctor in the Children's Hospital in Boston that did an endoscopy, she came out with very much excited, saying, wow, the results are excellent. You're almost normal. Your numbers are 30, whereas it used to be 165. And it's almost normal. So, congratulations. Looks like the treatment is working. And I hadn't been giving him any steroids. I had been doing Dr. Maker's protocol. And I said, no, we didn't do steroids. We just did, supplements and nutritional approach. And I have it on me. I have the list. Would you like to see? And she looked at my eye and said, no. And I was so upset because I thought this is a research department in Children's Hospital set up specifically to figure out what's causing this disease and how to treat it in kids. And she said no, just didn't want even to look. Dr. Michael, he just treated my son. The conditions became better. His stomach aches were gone. He felt much better. He even, his depression was gone. And by the way, the conventional doctors were trying to treat him before. They were trying to give him this Prevacid, and they had been giving it to him for 2.5 years. And he developed low bone density. These GI doctors just were giving him one pill, destroying his bones, not even knowing. What I like about Dr. Makel is his a whole body approach. He thought that we should think about what's causing those allergies. By the way, my son had been very allergic to other things such as tree pollen and cats and dogs. And with this treatment, not only his esophagus situation got better, but also his allergies got better. So he doesn't have any hay fevers in spring. So, but we religiously repeat that protocol every year. So 1 month of the treatment before the pollen season comes in. So I really appreciate that Dr. Mackey's approach, and my son loves to come here. Wherever he has any pains or from sports, he begs me, Mom, take me to Dr. Mackey. About a year ago also, my son developed a very weird nausea, like incidents of nausea happening couple of times a day, and he was not comfortable. It was bugging him very badly, and he was complaining, and it took him immediately to Dr. Makel, and Dr. Makel checked him and said, it looks like his gallbladder needs to be flushed, so you need to take care of that. And he gave me a protocol of so-called gallbladder flush. There are a lot of details, you can find it online about gallbladder flush, but what surprised me is that this is a very simple procedure. No drugs involved, no medications involved. You could do it once, overnight, and you will be treated. So we tried. It was quite difficult and challenging, but we tried, and yes, my son passed a very big stone, and after that, his nausea was gone for good. It was like a miracle. And we came to Dr. Michael to thank him, and he said it was not me who invented that. But the point is that he was the one who advised it to us. So I like his unconventional approach, and also I like his optimism. He is trying to explore something new. He talks about some new things that doctors just discovered. Before I brought my son in, for Dr. Michael to see him, I decided, okay, I'll try myself if this would help. Because before that, I had this condition. It was very weird. Nobody knew what it was. I was kind of sort of passing out a few times a week, and it was very weird because I was not completely unconscious. I was sleepy, and as if I was hearing people from the distance in a big from a big pot on my head. It was very weird sound. I wouldn't be doing anything. My vision was blurred. I would be sitting for 2 hours, very relaxed, very sleepy. I wouldn't be able to open up my eyes. And those incidents happened, twice or 3 times a week. I couldn't drive because that would, affect my driving. And I turned to conventional doctors, and they just, did numerous tests on me. They, MRI, they put electricity through me. I don't know, probably 6 or 7 very expensive, very comprehensive tests. And each time when I came for the results, the answer was, we have good news and bad news. Good news is that you're completely healthy. I mean, no bad results are great. So there is no bad results. But bad news that we still don't know what's going on with you. So that was happening for a while, probably about 1 year. And then by the time that my trainer recommended for me to, for my son to see Dr. Makel, I decided, why don't I see him first for myself and see if he is so good. And I came to Dr. Michael. He spent with me his initial appointment was also almost 2 hours. He did some manipulations on me and adjustments, and I was literally shaking on his, on his table. My knees were beating each other. I was shivering. Something was going on, and he explained to me what happened. It was something, I cannot even tell you exactly, but it was something that my left brain with my right part of the brain were not communicating quite well. And Dr. Makel actually fixed it. And right there on his table, I felt, something was going on. And after that, I was a little bit dizzy, but those incidents of passing out were gone for good. Not since. So I waited for about a week and another week and third week, and they were gone completely. At that point, I decided to bring my son. I figured that, okay, if he managed to help me with something that my doctors, after all these tests, still don't know what it was. So probably he might help my son. And that's how I brought my son. And I also brought my little son, and I brought my husband. So the entire family comes in to see Dr. Makel on a regular basis. And I recommended Dr. Makel to my best friend, and he helped her too. Whoever tried Dr. Makel's treatments out of my family and my friends and my acquaintances, they're very happy. And he really helped where conventional medicine doesn't help.